Helpful tips for getting diagnosed, part 1. We're going to compare inaccurate statements other people could say versus solutions. So if you hear common things are common, actually anyone can have anything anytime for any reason. For example, spontaneous genetic mutations can occur in a patient. They don't need to have a family history of something or certain risk factors. A patient could have a non-stereotypical presentation, such as chilblains instead of a malar rash for lupus. If you hear, but there is no evidence of, actually, the preparation and the reports need to be done accurately, and non-stereotypical tests need to be run. For example, not just ANA, antiribosomal P, CRP, ESR, we also want to look at complement C3, C4, CH50, ANA9, anticardiolipin antibodies, rheumatoid factor, CBC with differential, CMP, anti-neuronal antibody panels, including but not limited to anti-voltage gated potassium channel, looking at dopamine receptors. When we do scans, we want to consider a 3 Tesla brain MRI. So the different Tesla is looking at the strength of the magnet. So a 3T is going to have more detail. We want to look at with and without IV contrast because that can help provide a little bit more detail of the scan. We also want to consider different presentations such as deep brain seizures that may or may not show up on an EEG. Just because the report said normal doesn't mean that that's accurate, and just because a previous scan was read as normal doesn't mean that a scan done now would be interpreted as normal. As far as preparation is concerned, for example, you want to make sure you tell your physicians that all of the medications and supplements and other things that you're doing, because certain tests, biotin would interfere with that, and that's in a lot of multivitamins and other supplements. If you hear, but you don't meet the criteria for, actually arbitrary cutoffs and guidelines, they're not accurate. So for example, you can have a C. diff infection that requires hospitalization, even if your body temperature is not higher than 100.4 degrees Fahrenheit. Make sure to check out my other videos, and I'm going to be having part 2 come out shortly.